Thank you and welcome to the Aurora Blueprint. I'm really excited about today's episode. We've had a lot of patients say we know a lot about the surgery. We go through it so much in terms of the consent process and what's on the website. But what a lot of people are concerned about and don't know a lot about is the anaesthetic and the role of the anaesthetist. So joining us today is Dr. Jean Palmer. Jean is a consultant anaesthetist at Precision Anaesthesia and Royal Perth Hospital. Welcome and thank you for joining us today, Jean. To start off with, could you tell me a bit about what an anaesthetist is and what they do?
Cool. Thanks very much for having me, Ruth. So an anaesthetist is a medical doctor. We do 5 to 6 years of medical training. We then come out as an intern and then start in a hospital as a junior doctor. And at some point you decide on the training that you want to do. And in my situation, I've decided to do anaesthetic training. A surgeon would do surgical training. And then we would do 5 years of anaesthetic training, all while doing exams, working in a hospital, working as an anaesthetist. And then at the end of that, you come out as a consultant anaesthetist, and I've been practicing as a consultant for 15 years now. I think most anaesthetists, unlike surgeons, have a general anaesthetist in that we do lots of different specialities we have certain areas of interest, and one of my areas of interest is doing bariatric anaesthesia.
Thank you for that. And I think I recall working with you in 2011 at Royal Perth. So, yeah, I've worked with you for a long time on and off in various capacities. So thank you for joining us today. A lot of patients are worried about going under. They don't really understand what that is or what happens. So can you walk us through what actually happens during bariatric surgery?
I think it's really important to remember that anaesthetics, general anaesthetics, are incredibly safe. And your anaesthetist is with you for the duration of your operation. They're looking after you, making sure you've got all the right medications on board and you're going to wake up nice and smoothly. But basically it starts with we see you beforehand and we'll chat to you. We'll then put a small plastic drip in one of your veins, usually in your arm. We bring you into theatre. There's lots of safety checks that go on to get you to that point. We'll attach some monitoring, and then we would give you oxygen via a face mask, which fills your lungs up with oxygen, and then you're off to sleep with a general anaesthetic. For the surgery, Dr. Ruth needs to create a space to work, and she pushes gas into your abdomen to expand your abdomen so that she can do the operation. And then she also requires the table to actually be tilted so the patient is almost standing. That creates quite significant changes in blood pressure and heart rate, which keeps me on my toes. I'll then give you lots of painkillers, anti-nausea drugs, so you wake up nice and comfortably, and then I'll then transfer you to recovery where the recovery nurses will take over your care.
A lot of patients do worry about that. They heard somewhere on Facebook and other places that they'll be standing during the procedures. So you've explained what that is there. Pretty much standing, but they are well supported using a foot plate, straps, and held into position. So that works really well from the surgical and the anaesthetic perspective. So what happens before the operation even begins?
Yeah, so every anaesthetist will always consult with you before you have an operation. Now that might be a week beforehand, it might be the night beforehand, or it might be just before your surgery. But we'll always talk to you about your past medical history. We'll ask you about your medications. We'll ask you about whether you have any allergies. And we're very interested in whether or not you've had any issues with previous anaesthetics. In particular, we always look at your airway. So we will get you to open your mouth. We'll look at your neck. We'll look at your teeth. We want to know how easy it's going to be to put a breathing tube into your trachea. We're very interested in your lung function, and we're particularly interested in your heart or cardiac function. We'll ask you questions about sleep apnea or whether your partner has noticed that you're a loud snorer, because sleep apnea can actually mean we might need to have additional monitoring for after the surgery. We'll talk to you about your medications beforehand. We'll talk to you, explain to you fasting. We'll often, if needed, we'll give you something to relax you beforehand as well. And we'll talk to you about the relevant risks that are important to you for that particular operation. I think the one thing is that every single patient is different, and we will always give a nuanced, specific, tailored anaesthetic for that particular person.
And I'll admit that I'm no expert in what happens on your side of the drapes. I know what's happening on my side, but your side is a whole new world to me. So I have seen airway management mentioned in bariatric surgery. Can you tell us a bit about that?
Anaesthetists specialise in airway management. That's basically our bread and butter. We do it all the time. And so we get good at doing something that is quite daunting to other people, other doctors. Bariatric patients frequently have more difficult airways and they have a higher incidence of sleep apnea. Now that makes it a bit more challenging for us. But what's changed in the past 10 or so years is that we have some pretty fancy equipment. In particular, we have cameras on the end of our laryngoscopes that basically allow us to see around corners. So a laryngoscope is like a blade or a plastic or a metal blade that goes into your mouth to pull the tongue out of the way so we can put a breathing tube in. Now, if you've got a camera on the end of that, we can basically see around the corner, making it much easier to put a breathing tube in. Now, in addition, we also train for scenarios when things get difficult. So we've got lots of backup plans in place.
And so while the surgeon is operating, putting ports in and performing the procedure, what's happening on the anaesthetic side? What do you do?
I think some people think of anaesthetics as being particularly boring. And that might be true if it's a 10-hour operation, okay, and nothing's happening. A bariatric operation is not a boring operation. It's 90 minutes generally, and it involves going to sleep and waking up. But in between that time, the surgeon, Dr. Ruth, will put ports in and insufflate gas into the abdomen to create that space with which he's going to work. We go steep head up. Now that causes blood to pool in the legs. It can cause quite significant changes in your blood pressure and your heart rate. So I'm always tinkering to make sure those things are normal and make sure everything is, all your physiological parameters are normal. Monitoring your breathing, and I'm even monitoring the electrical activity of your brain to make sure you're adequately asleep. I'll then give you lots of painkillers and anti-nausea drugs, and they've then got to wake you up and have you ready to go to recovery, where the nurses in recovery will take over your care.
So a question that patients often ask is, how can I help? What can I do to make the anaesthesia and surgery safer? So
I think the key thing you need to consider is to follow the preoperative low-calorie diet that you've been prescribed, because the weight you lose comes from your liver. It'll reduce the size of your liver. It'll make your surgery easier and safer. The next thing you need to do, if you're a smoker or a vapor, you need to stop. Now that applies for every operation. We always recommend you do that, but in particular for bariatrics, we want the staple line to heal, and smoking and vaping impair that. And so stopping is the most important thing you can do. The next thing you need to do is you need to tell us about your medications and your supplements, okay? Because we will need to stop some medications, and some supplements can cause bleeding. And people don't always think about mentioning those. And with supplements also, they're not as closely regulated as pharmaceutical medications, so we don't always know what's in the actual ingredients. If you've got a history of sleep apnea, bring your CPAP machine. And if you're known to be a loud snorer, please tell your anaesthetist and the nurses. I think the other thing, and it's really hard to do, we want you to try and relax, because a relaxed patient is going to have a much smoother journey. I can help. I can give you things like pre-meds beforehand. And if you're particularly anxious, you can call my rooms and we can discuss it beforehand. But I think it's really important you also know that you're going to an excellent hospital. It's really well-resourced with highly skilled caring nurses. And Dr. Ruth has assembled a team around her that is her regular team who work really well together. So you're in really good hands.
Thank you for that, Jean. I really appreciate that. And in our next episode, we're going to go through a bit more about pain, nausea, and some frequently asked questions. But thank you for your time today.
Thank you.